This is Healthcare That Clicks, where healthcare, innovation, and big ideas collide. No fluff, just the strategies reshaping the future of care. Here are your hosts, Ryan Kelly and Will Moon.
Welcome to Healthcare That Clicks, the podcast where innovation, ideas, and technologies are shaping the future of healthcare. My name is Ryan Kelly. With me is Will Moon. We're your hosts for Healthcare That Clicks. That today we'll be discussing a topic that we interact with every single day, whether you realize it or not. Wearables, and in a way, the implantable healthcare technologies that exist in our world. Just a few years ago, most health information was collected on the occasional visit to the doctor's office. Today, literally millions and millions of people are wearing devices that are continually monitoring their heart rate, their sleep patterns, activity levels, stress, heart rhythms, and so much more. At the same time, the implantable devices that are growing bigger and bigger as a market are helping patients to manage chronic illnesses, prevent medical emergencies, restore hearing, control pain, improve quality of life, and affect disease outcomes in ways we've never even imagined before. From smartwatches and fitness trackers to continuous glucose monitors, pacemakers, and implantable cardiac devices, healthcare is rapidly moving from episodic care to continuous care. These technologies are creating new opportunities for patients to better understand their health, for providers to monitor conditions closely, and for healthcare systems to identify problems before they arise. And in a modern healthcare system, to be able to identify those problems early, to hedge off costs, and to improve patient outcomes, that is the key to being successful in healthcare today. But with these come challenges. How accurate are the devices? How long will they last? What sort of liability is there for the providers subscribing to these devices? How is the information going to be shared and the privacy around that? So many things that we need to consider when it comes to wearables and injectable subcutaneous devices. So we're going to look at that today and a lot more. So Will, thanks for being on. Question for you to kind of kick things off for us. We talk about the term wearable technology, and I think we all have an idea in mind of what that looks like. But in your mind, it's really so much more than just an Apple Watch or something. In your mind, what is a wearable technology, and what's kind of the breadth that you've seen of this wearable technology in the marketplace right now?
That's a good question. And I mean, when you think about wearable, thankfully, it's kind of implied in the name, right? It's something that can be worn on your person. So when we think about wearables, I think a lot of people initially go to a watch, right? They go to a smartwatch of some sort that'll take a vital reading or track your sleep or activity, count steps, that sort of thing. A lot of people, activity there being kind of a key thing. Think about, wearable technology in the health space is really just that, tracking activity. The vitals is kind of where I think Apple did a lot to change the game there with blood pressure and pulse and some other things that they added to their Apple Watch. And so, when we think about it, I think it's expanded. For a long time it was kind of just like wearable, smartwatch. Then you had other, companies or products come to the market like the Cora, the smart ring.
Yeah, well, I've definitely been thinking about the Oura Ring and some of those others that can track sleep patterns. That's one of those things my daughter and I have been wanting to do a little bit more is track sleep and see if we're waking up in the middle of the night, if we're stirring. So that looks like one of those pretty cool devices, and it seems to hold a charge a little better. That's one of those limiting factors in my mind is some of the devices have to be charged almost on a daily basis, but some of them can last a little longer. So that's kind of where my mind is going. What do you think?
But yeah, I mean, the amount of time that it'll hold a charge is going to be significant. There's also a lot of, I'm sure, studies being done on having batteries that close to your body and your skin and for prolonged periods of time. The watches are also kind of uncomfortable for people that want to track sleep. I track sleep on my watch. I use a lot of the insights and whatnot just to keep an idea of my own personal health for preventive care. But the other wearables that kind of come to mind that are getting more popular are obviously the Dexcom or the continual glucose monitors, where more and more people are monitoring blood sugar levels, and it's not just purely from a clinical standpoint. It's kind of like I was just mentioning for me and my Apple Watch. It's from a preventive care standpoint. People want to know what they might be at risk for, especially with the foods that we eat today in the U.S. and all of the saturated fats and high fructose corn syrup and everything else, you would be surprised at the amount of people our age that are pre-diabetic or have developed type 2 diabetes. I mean, I think even in Mississippi alone, almost 14% of the state is diabetic.
Yeah, and that's probably a conservative number, would be my guess.
Yeah,
14% that we know of.
that's
Or
right.
that they know are diabetic. No, absolutely, and then you get into the fitness industry, and you get a variety of other types of, measurements, various enzyme measurements and lipids, and, just keeping track of all this for performance. That's a whole other wrinkle here. So, yeah, whether it's a prescription-based and a clinical-based, if it's something for your own health or something for true athletic performance, these wearables are everywhere. Almost every electronic store you go into, there's multiple different types. Obviously, you can order them online. You see commercials for them. So the market is full of various types of wearable devices right
It,
now. And I've been
Matt,
impressed with early ones that have lasted. Like Garmin has done really well. I remember
Garmin,
when it first did like the GPS running, and that was all that it did. And now
right.
they've lasted. They adapted and they've stayed in the marketplace.
They have, and another good pivot story for that, which is kind of an interesting one, is well, and it'd be interesting to see. I haven't looked in about a year how well it's doing, but Best Buy made a similar pivot into the health
Mhm,
tech wearable space, and
mhm.
that really helped with driving traffic to buying technology in the store because who does that anymore? I guess.
Right. That's right.
And so one of the things that is going to be interesting is the way that the wearable space will develop. So, just to kind of go back and summarize really quick, when we think about wearables, we're thinking about a watch, maybe something that hangs around the neck. We're thinking about a ring or some sort of patch,
Mhm,
right? And so some of the ways that the wearables are niching down, so to speak, is focusing on like women's health or pediatrics or chronic care, like you mentioned. And so, there's a lot of buzz around EKGs and trying to get some sort of EKG wearable or
mhm,
monitoring system into the market that's not cumbersome, doesn't
mhm,
require a bunch of nodes and, can get an accurate reading. A lot of the wearables are being used in the pediatric space. I don't
mhm.
know if you've heard of Owlet, but they have like a wearable that will monitor heart rate and breathing.
Right.
So
I have
for
that.
newborns or infants, I'm a father, you're a father. We all remember what it was like when you have newborns and infants, and it's almost too stressful to go to sleep sometimes because
Yep.
what's going to happen? What if I sleep too hard? Women's health is another one. Women's health is always a big target when we look at health niches.
Mm,
So the EV ring and the Ava bracelet, I think, are the two when I was reading that came up the most for tracking menstrual cycles, fertility signals, reproductive health, a lot of those things that are more specific, obviously, to women, but rings and bracelets, which also work into that consumer market really well. And so when
mhm,
we look at wearables, the other thing that we're seeing there is the design around the wearables to put the tools in people's hands in a way that doesn't stigmatize it, doesn't stand out too much, doesn't look overly like it came from a hospital, and it's able to, work well with everyday wear or something like that. So the adoption there to that point has skyrocketed. I mean, you mentioned the size of the market. I think when I was doing the research, the wearable market is at 100 and the industry is at 153 billion dollars when we look at wearables.
That's amazing.
Now, the health tech wearables is going to be a smaller subset of that, but it's
Mhm,
still almost half of that
mhm.
market is just like health tech wearables.
Yeah.
Dexcom has exploded, and that's where, when we talk about preventive care, I'm hearing so much more about people in the fitness world that are getting a CG just because they want to know what their glucose levels are on a
Mhm,
daily basis because they're, athletes or for performance or whatever else it is, preventive care, and then the other thing I think is worth mentioning when we think about the prevalence of wearables in the market now is the adoption rates. Like the thing that has made the industry, the thing that has helped propel this, one is having a wearable that, obviously is consumer driven, that looks good, people wear and use. And then from that, we're getting insights. And so we've gone from, just collecting data to actionable insights,
mhm.
which, we can put a pin in that and come back to it later. But the industry's really grown because of the adoption rates. I think when I was reading, I say when I was reading, let me reference my note. So this is what I thought was really interesting because one thing in the wearable space when we look at adoption, so like broad blanket statement, 57% of adults, so literally 3 in 5 U.S. adults have a wearable of some sort. I have an Apple Watch. You said you have a Core Ring or something. What do you
I'm
have?
looking to get one. I don't
Yeah,
have one right now, but I've got a finger who's itching to get one on there right
itching.
now.
A finger needs it.
Yeah.
All right. So when we break down that 57% though, and we think about wearables and the future of it, it's kind of good context with the rural health program and a lot of the focus on underserved or healthcare deserts or gaps in the
Mhm.
US right now, because wearables might actually provide an opportunity to close some of those gaps or
That's right.
fill in some of those deserts purely because of adoption. So, example, when we look at the wearable and underserved in rural markets, high income ownership is 67%, while low income is 41%.
Huh.
So it was kind of interesting. Like those making 50,000 or less a year was like 41% had wearables.
That's
Those
still a pretty high
making
number, though.
yeah, those making 200 plus a year were in the 67%
Okay.
adoption rate.
Okay.
And so it's kind of interesting that that gap there. We could probably get into like the socioeconomics of
Yeah.
why those two classes are purchasing similar devices. But just from like a healthcare standpoint, that means that you've got a lot of people paying attention to it and getting access to wearables,
Mhm.
not even fully with the idea that it's for their health
Mhm.
or that it's, a preventive measure, but more so just because it's cool or it's like the trend thing to do. And there could be this cool moment within healthcare where, you could take advantage of this trend to really make a difference for patients because so many people are producing data now on a consistent basis that's giving actionable insights.
Mhm. No, I think that's really interesting. It really is. And so, before the call, you and I were talking about the update to the Rural Health Transformation Fund and where some of that money was going to be used. And I would love to see some pilot programs on healthcare providers purchasing wearables for their patients and having that data come back into their EMR, actionable data that can be used. I mean, I really think that is the bullseye of what this fund is designed to do, to take health information and give it to providers for them to take meaningful use to treat patients in a more effective way. And the
Agreed.
wearables are a great way to do that.
I agree. And, in spite of what United Healthcare might say, remote patient monitoring is highly effective. And that's one thing that we see all the time with our chronic care patients. We get them a monitoring device, and it's not the device alone that makes the difference, but it's the insight back to a clinical team who can act on that makes the difference. And that's it's such a big key on the chronic care side to monitor blood pressure to help prevent unnecessary ER visits. I just think about all of the other use cases and actionable insights from the wearables out there. You got a benefit from an older patient with a blood pressure monitor periodically taking her blood pressure. That alone is helping with prevention. Imagine how much more you could help with prevention if you're getting data from someone who's constantly wearing something.
That's right.
So you're getting a full picture of the data instead of fragmented.
So I just did a little search, and I know with Link, you've probably had this data on hand, but I wanted to just be curious. Since you mentioned with how high the percentage was of those that are in the lower socioeconomic class having a smart device of some sort of wearable. I want to see what is the percentage of U.S. citizens in general who have a smartphone. 91
Yeah.
of US
Yeah.
citizens own a smartphone, and 98% of US citizens own a cell phone, which could be, one of those dummy phones you have, one of the, I don't know what they used to call them, but the old school phones that you and I grew up with before they became smartphones that you can still get telehealth connectivity to. You just won't be able to access the data like you would with a smartphone. So if that's the case, I still have a lot of conversations with people that will say telehealth can't work in rural areas because not enough people have a smartphone. And there are people that do not have a smartphone in rural areas. I can attest to that 100%. That
Well,
is the case. But
Mhm.
if you're talking about a large percentage of the population, and we're talking 98 plus percent of those that are under the age of 55 owning a smartphone itself, not even just a cell phone, but a smartphone. If that's the case, there's really talking about your senior citizens 65 plus are the main group that don't have an actual smartphone. Jitterbug is what I was trying to come up with.
Yeah.
Non-smartphone.
Yeah, I do think those conversations are interesting. I'll be honest with you. I think it's kind of a lazy excuse.
Mhm.
And the
Because
reason I say that is, all of the patients that we work with are 65 and old. Like my average patient is a 78-year-old female. And so when we look at smartphone adoption, I would say probably 2 out of 3, so 75% of our patients have a smartphone. The other 25% may not have a smartphone, but they are accessible and they all have caregivers who have
Mhm.
smartphones. So like the other statistic that no one really wants to talk about is in the US, there are 53 or 54 million unpaid caregivers for patients with chronic illnesses or disabilities or something else. So you think about, especially when we talk about chronic illness or just a patient that has a disability, there's going to be a spouse or a parent or a sibling or a child, somebody in their life that is active in their care. And so there's a way to get to patients.
Yeah.
Trying to say that, oh, they don't have access is kind of the easy way out. But I think the true numbers with telehealth that are probably more, disconcerting would be the adoption rates from both providers and patients. And that's really you've got doctors that use it as like, oh, this thing that we may use if we have another pandemic. And so especially from what we've learned, and not to trail off on telehealth, like specifically telehealth too much in that way, but if doctors don't advocate for it, if doctors don't push it and use it as a tool, patients will never adopt it. And so that's one of the reasons why we see adoption rates so low. People always say telehealth's not working or this or that. Like telehealth works. Telehealth is paid for by most payers. Like of the people that say that they're having a trouble getting telehealth paid for, it's either a billing issue tied to like a POS or a modifier or something, or you're just not billing it,
That's right.
because it's paying and it works. The real number is that less than 3% of all claims, whether we're talking federally or even in the state of Mississippi, are telehealth claims. So
Mhm.
the real problem there is usage, not
Absolutely.
not coverage, not access, but usage.
So I was just at a physician conference this last weekend and speaking to a lot of physicians about telehealth adoption, and that's exactly what I said because they a lot of them tried to say about the
Yeah,
wearable or the lack of having a smart device that they could use, and we start getting into the numbers, and then it goes into connectivity. Now, connectivity is absolutely a factor. If you've gone to some rural areas, you'll go through some dead patches where there is no data at all. I went through the Mississippi Delta on the way there. I had no data at all in a few places. When I crossed the Yazoo River, there was no data. But there's
right.
probably not many people on top of the bridge over the Yazoo River. They're trying to do a telehealth call. Once I
No.
crossed and went back into the next cell phone tower range, I had data again. So then it comes down to what I think, and you identified well, is the real problem. It's the scheduling and it's the logistics of how to do it within the clinical
Mhm.
practice and getting patient adoption. And I think the wearable connectivity is the exact same thing. And when it comes down to it, it is difficult to schedule in and to coordinate in data along with what the normal traditional in-person practice is. And so I really feel like we're at a fulcrum where we have to get past this old school in-person only, get your patient history, go back through the record every single time the patient comes in and take your vitals, your labs, all that, and that's all the data you have,
Mm.
versus the new side of capturing this data in a continuous flow, have AI built in to give you flags when there's something that's out of balance, and then you jump in preventatively and go and solve that solution for that patient using the billing codes that we now have. And again, like you mentioned, the telehealth billing codes that aren't used, a lot of the wellness and prevention billing codes that are there are not being used either. And if done correctly, you could actually make more on the wellness and prevention side than you can the sick visit side, but
Yeah.
it requires a complete change in mindset. As
Hmm.
one physician in Alabama says, a paradigm shift in the way that we deliver healthcare. You have to think wellness, prevention, data, use technology versus the old way that I love, but it's a 19th century, 20th century form of healthcare.
We
I
don't love the old way. We don't have to caveat that. We don't love the old way.
Well, I love the old way like I love Andy Griffith. Is it
Yeah,
better than the modern TV shows? Maybe not in a lot of
that's
ways,
fair. That's an
but
interesting way
it's
to
the
say that.
same.
I like it. I like that.
Yeah.
Yeah, I mean, I think the thing that, like anything else is like there are traits from the old system that, are worth, replicating, carrying over. But the system itself, it's to speak to what you just said, it's designed around sick care. So it's not just the individual doctor, it's the
Mhm,
entire system when we talk about the paradigm shift. And really, like, to use your word, the fulcrum there is the mindset. The mindset is the fulcrum. So which way is it going to tilt? Are we going to tilt towards reactive care, which is what we've been doing since the 70s? Or are we
mhm,
going to tilt towards proactive care? And I think finally, after almost 60 years of one payment model, CMS is finally going, hey, we should pay for prevention.
mhm,
We should incentivize prevention more.
mhm.
Why have we not been paying these guys more for prevention than just for sick visits? That's why they're not doing it. And so there's a bit of a wake up call coming from Washington too, and you're seeing more of the codes geared towards prevention, like just with Medicare as example,
Mm.
chronic care management, remote patient monitoring, annual wellness visits. Those are the things that they're putting a focus on.
That's right. And the name of the game is keeping costs down. I mean, if you're a provider, if you're an insurance company, you want costs to be low, you want efficiency to be high. And if we can help carve out or eliminate those high cost elements of care, which are usually end of life care, something that's a major disease like cancer, stroke, something like that, and then the high cost of pharmaceuticals, if we can reduce those and decrease those big hitters in the system, that's worth everything to them because
Mhm.
most of their cost comes into that or the little nickel and dime things that add up. But really, it's those big ticket items that they just need to get rid of. And so that's why they want wellness and prevention. But we have to find a way to do that within the modern clinical practice. And that takes both sides. It takes the patient and it takes the provider to be able to find a good solution there. And as you mentioned earlier, patients taking control of their own health and using these wearables in that way to monitor your hormone levels, to keep track of your weight and your cardiovascular activity, your calorie count, your blood pressure, heart rate, all the tangible quantitative data points that we can get that you can measure yourself by. The more we can do that, the more we own our own health and the more we can take control of it.
I mean, that's a really good statement. That's a really lofty goal.
Very.
Whenever we've seen it play out, whether it's been new companies, new services, new payment models, new clinical models, whatever it is, like owning your own healthcare still kind of sits at the top. Uh, it's
Mm.
it's so funny how like we're as people, as humans, we're so proactive in all of these other aspects of life except our own health. And it's not a shot, but I mean, even look at the doctors. Look at, you go to the doctor, and I don't always go to my doctor and think like, man, you're a picture of health. So it's prevalent just within the US culture. And there's a lot more. We could probably do a whole separate podcast on this, but there's a lot more coming out on food as medicine. And I
Yes.
think that's a we could tie in the digital health side because there's tons of apps and tracking and ways that we could tie that in. But food as medicine is a very interesting one that's getting more popular.
It really is. I hear that term used. We heard it back in like the mid 2000s, and I
Yeah,
hear it
yeah.
used a lot more again. And I'm glad because in
It's
the end of the day, if we ate healthy, about 95% of the problems that we have wouldn't exist.
yeah,
And
yeah. And
myself included. That's a self actualization too. I like fried catfish just as much as the next.
same. I'm a fan of all fried foods, like any good Southerner.
Yeah, they're a fan of us too. They like to hang out
They
right here on the
they
love
are.
handle, right in the back.
I will say it's kind of interesting, like to your point though, and not to tangent off onto food as medicine, but it probably has been about 15 to 20 years since you've heard about it.
Mhm.
And the reality is, what has happened in the last 15 to 20 years? More and more lawsuits have come out against food companies or
Mm.
massive food producers, exposing social media has done a good job of spotlighting certain ingredients, the processes, or providing education on the processes for how the FDA approves what goes into our food. like I didn't even know this, but the FDA has like a list of 6,000, something like that. It's thousands of approved ingredients that can go into food, like these artificial ingredients or whatever. And like just for comparison, I think France's list is like 300 or 400. So it's some of those comparisons that are just like, yeah, it's very interesting to dive into and to think about. But now that more of that spotlight's there and people are kind of educated on it, it's changed the narrative, even from a healthcare perspective. And we see that trickle down with like food as medicine.
Yeah. No, absolutely.
There
So
was,
pivoting over to the second topic we're going to talk about, which is the implantable devices, and this one gets
well,
sticky
hey,
because
hang on. I was going to throw out one more statistic for you on
oh,
that
go ahead, let's do that. Yeah.
real quick. So when we look at wearable ownership
Hmm.
outside of just income basis, we look at geographic location. 64% of the ownership is in urban areas and 48% is rural.
Mm,
So they're saying 48% of rural residents have some sort of wearable. 64% of urban residents have some sort of wearable.
I can see that. Yeah.
I mean, even from that perspective alone, when we think about the underserved markets in the state, which after I did some digging, I will say the Delta is not, it's actually not the most underserved area in our state. There is a
What
there's a
Southwest?
Southwest corridor
Yeah.
there's 4 or 5 counties. There's 60 miles or further away from a major health system. And in those counties, they don't even have access to neurology and some
Mhm,
other basic specialties. So that's where when I think about wearables and like those demographics, I'm like, that's who we could serve, you know?
mhm. That's right. Absolutely. Yeah, the Southwest Mississippi corridor is most people think the Delta, they think maybe pockets of Northeast. That's really that there's a big gap in that section. Louisiana kind of has the same thing. They've got some sections that are very blocked off from a health access standpoint. Alabama the same way, Arkansas largely the same way. You've got some pockets there that are not necessarily the Delta that are major health deserts. No question.
Mhm.
Yeah.
Yeah, I I didn't know that. That was some new information to me because I think the Delta is the one that gets the most media attention, and I think it's just because the Delta is better represented politically. Like the
It is.
politicians in the Delta do a much better job of advertising the need
Mhm.
than those politicians in the Southwest.
Yep.
Now watch, all the politicians in Southwest Mississippi will have some comment about that, but come on, guys.
Well, no, but I mean that I think you're exactly right, and I know many of them down there, and it's largely your blue collar farming communities, but not necessarily those that have stereotypically been pointed out as having those levels of challenges. So
Hmm.
I've been all through there, and I know many of these communities, and they're great communities, but you don't think about them not having access until you really start mapping it out and realize they are 60 miles plus from the nearest hospital, and there's only maybe a nurse practitioner or maybe a physician that serves in the entire county radius.
Yeah.
It is a major limitation. It
It
absolutely is.
is. And when you think about the demographic there, you've got a bunch of independent Southern farmers that aren't
Mhm.
used to asking for help. So
Yeah.
that's one thing that we've noticed a lot with our older patients with chronic conditions that we work with is, you still have this kind of, especially below the Bible Belt, this old kind of Southern independence that's there where people don't like to ask for help. They
Mhm.
don't even like to let you know that they need help.
Yeah,
Much
that's
different from the generations coming up that need help with everything.
I need help with everything. That's right. Exactly. So
All right. Your favorite topic.
yeah. So implantable devices. This one is tough, and talking about the Bible Belt, this one especially hits us from an ethical standpoint because you've got every sci-fi movie almost in existence that there's implantable devices like you're the Borg and you're part of the collective, and so obviously that's something that's of major concern for many people, including myself. But then you think about someone who has Lou Gehrig's disease or someone that has Parkinson's or dementia, Alzheimer's. And if an implantable device like a Neuralink or something like that could work and could give you an element of your life back, then that gets into a philosophical and an ethical conversation, at least, of what is appropriate, what is the best use case. Now, some listeners will say absolutely everything, roll it out, technology is going to make humanity better. Some will say absolutely nothing. It's the mark of the beast. It's the worst thing in the world. And then probably some of us would come into maybe a medium which is what is your heart behind it? Are you really trying to become a humanoid versus a human and trying to become one with the machines, or make yourself something that's like a superhuman kind of robot hybrid, or are you just trying to live life and solve solutions and help someone who's truly suffering from a disease that might could live life a little bit better? I don't
Gosh,
know. Toss it over to you. What do you think from the ethical standpoint first before we dive into anything else?
what a dichotomy. I will say, like, just as a bit of humor, the first thing that kind of comes to my mind is you imagine a bunch of people with implanted wearables. Hackers would have a field day. You think it's fun to go hack a government? What if you could hack a person? Like
Mhm.
that, it just
Well, I mean, there's already pacemakers, which is an implantable device. It's been there for a long time. Pacemakers that are now connected to the internet. And yeah, ransomware on someone's pacemaker, give me $100,000 or your heart's not going to take another beat. That is a real reality that we
it,
face
yeah.
today.
Yes. So let's piggyback on that because I think that's a good basis for a jumping off point. Obviously, there's a lot at play here. There's a business side of it. There is a healthcare and a clinical side of it, and there's a moral and an ethical side of it.
Mm,
It's a prism. It's got many different sides, and there's different ways that you can look at it. And depending on what lens someone looks at it through is going to depend on, the solution that they see there, whether they're
mhm.
for it or against it or whatever else. So let's do that. Let's go back to the pacemakers, which are a wearable device. Now, what does a pacemaker do? Right?
Yeah. Regulates heartbeat, make anyone who has an SA or an NA synapse issue regulates the electro impulses between those nodes.
Boom, look at you. I'm not even clinical and you answered it. I didn't know the answer. I was hoping you did. See? All right. So I knew it had something to do with the heart and blood flow. And so one of the things that the pacemaker does is introduces an implant device into a patient where without that pacemaker, what's going to happen? Some sort of event. We're not clinicians, so yeah, some sort of acute event, right?
Mhm.
Cardiac or whatever else.
Yeah.
And so we're using this implanted device to prevent this. So how is that? Because their life is dependent upon this. How is that different than the other implants that we think of later?
Mhm.
Does it change now that we're implanting the brain and we're
Mhm.
not just helping the heart pump or whatever it is, but we're actually, controlling thought and other motor functionality? Like,
Mhm.
is that the thing that separates this? And it's kind of one of those things where I don't know.
Yeah.
I don't think anyone really has a good solution to it. And I think there's two sides of the coin. There's one side that, like you were saying, it's like the mark of the beast, and one side saying, hey, let's let technology fix what we can. And the reality is, like, you have one side that's very solutions oriented, and you just have one side that's scared and cautious.
That's
And they
right.
don't know, it's scary. We don't know what that means. And, to look at it from that perspective, I think there's a lot of people out there and a lot of different companies doing good work on solutions to problems that they see. I don't necessarily think a lot of people are looking at the moral and ethical implications of this. I think it's more just, hey, this person can't walk. What if we could help them walk? Wouldn't that be great?
Mhm.
It's more of the human stories that drive the motivations behind these things rather than some large conspiracy like Elon Musk Neuralink. You know, I mean, the reality is that guy is just trying to, create businesses on these sci-fi adventures, right?
Mhm.
Or sci-fi ventures rather. And so, for whatever reason, that's one that he's keyed on. But if we look at it, like you were saying, for someone that's paralyzed or with Lou Gehrig's disease or some other degenerative disease with motor functionality or brain cognition, what if you could improve that? And I don't know if you've looked at the Neuralink technology, but it's
Yeah.
got these like microfiber hairs and it has to be surgically implanted with a robot
Mhm.
because these little microfiber hairs are the ones that have some electrical charge and they're looking for those synapses firing off of the brain, those charges firing off to pick up on them and then communicate to the rest of the body. Similar in a way to the other implant, the pump.
Mhm. Yeah. Yeah. So I try to take this. You and I are both Christians, and I try to take it. Not that normally our podcasts don't go down a biblical worldview, but I think it's for those that are watching that are having this struggle right now. I'm going to kind of talk through this let's talk through this and let's kind of see where we could fit our religious viewpoint in with the technology. Because I think this could be helpful for others. If for someone's not a Christian, just tune this part out. You're probably not going to care. Why is drinking to the point of getting drunk or taking drugs a sin? Why, in your viewpoint, is that sinful?
Well, it's overindulgence.
Mm-hmm.
It's
And it's changing who you are, taking away inhibition and
sure,
changing your mindset to be something that you don't have otherwise, right?
sure. We're called to be sober minded, so keep your
Yes,
thoughts clear.
exactly. So that would separate a glass of wine from a bottle of wine as being one thing that could be healthy and good for you with antioxidants and something to do just for fun, kind of like having an ice cream cone versus a gallon of ice cream. One
Okay.
one is a tasty treat, one is gluttonous, right?
Hmm.
The same kind of thing. Now, gluttony is a whole other thing, but I can only imagine what my brain's going to do with a gallon of ice cream. It's probably going to be very similar to drinking a bottle of wine. So I liken that to the same thing. Are we using an implanted device to change who we are for an unrighteous and ungodly reason? Or are we doing it to correct an element of sin in the world that's corrupted our brain, our bodies? And are we trying to bring it back to the way that it was prior to that degenerative thing that happens? So Lou Gehrig's disease is a good example. Degenerative neurological disease. You're not trying to become something better than God made you or different than God made you. You're just trying to get back to square one, right? And so that's where I could think something like a Neuralink or a similar kind of a implantable device to get you back to having basic motor function so that you can live life as best as you can while you're here on this earth would be a good thing. And I think morally and ethically, I can justify that pretty well because I'm not trying to do anything different other than just get myself back, like a pacemaker, like a knee replacement, like whatever else. Now, if I'm trying to put an implantable device to make myself a superhuman, shoot lasers out of my eyes or be able to access more parts of my brain than I could normally access as a normally functioning human, or whatever else, connect to the internet where I can search the internet via my brain. Now that's where I personally would draw a pretty solid line of this is too far and we're going beyond what God wants us to do. But again, that's an individual, where's your heart? What are you trying to do kind of a situation where I would find it very hard to draw a holistic line in the sand and say, this is where we are going too far, because it's a very individualized thing. Some people don't need to use credit cards because they can't control debt. Other people are just fine using credit cards because we hate spending money regardless of whether it's a debit card or a credit card or cash. So it's individualized results. What is our weakness? What are our desires? And what are we trying to do with it? So
Mm.
that's where I just say all of that to say I'm not opposed to any of it, but I could be opposed to all of it depending on what we're trying to do with it. Does that make sense?
It makes total sense, and I think to your point, there's going to be a lot of individual conviction that goes into it. Like one thing I think about is like, because everyone's always like, you're playing God or something, right?
Mhm.
You don't play God. Don't you can't change these things, or like if this happened, it's for a reason. It just has to be that way. But there's plenty of other medicines that the Lord is allowed to improve. There are prosthetics that the Lord is allowed to improve life and functionality for people, medicines for healing, other types of machines and technologies used for treatment for cancer
Mhm.
and whatever else. So clearly, some of that is permissible because as a Christian, you have to believe that nothing outside of the Lord's will happen. And so
Mhm.
if these things are happening, they're permissible. And so when I think about some of these big leaps in technology that people are trying to take, I kind of, I go back to, and I'm sure someone could come at us hard on this with cloning or something, but
Right.
I go back to like, like the Lord will let us have our Tower of Babel moment,
Mhm.
like as humans we can be sinful and hubristic, and so once that rises to a certain level it'll be cut down
Mhm.
if it's not the Lord's will, or if it is the Lord's will it'll develop and go to market, like
Mhm. That's right.
like some of these other things that are out there, and it could do good. But also to the other point, it is a broader topic to kind of zoom out and also think like when you put solutions out into the world to solve a problem, and the solution in and of itself is not a bad thing, but a good thing, kind of like you were saying, is it if that solution could be used for harm, do you not put it out?
Yeah, that's
And
right.
like, that's something that pharmaceutical companies go through all the time. That's something that other healthcare companies that go through. But like, just because this thing could be misused doesn't mean that you shouldn't put it out for its intended use.
Exactly.
One, that's going to step on some toes for people, but GLP-1s.
Mm-hmm.
Okay,
Good example.
GLP-1s were developed for diabetic patients, and then it got into the consumer market, and it's become a cheat code to lose weight. I always think it's kind of interesting. I don't know if you know who Palmer Luckey is, but excuse me, but Palmer is the guy that created Oculus, sold it to Facebook for a couple billion, and then he started another company, which blanking on the name right now, Anduril. He started Anduril, which is kind of a tech company geared towards the military, similar to Palantir. And before he started Anduril, after he made his billions from Facebook, he is trying to figure out like what new business he's going to start. And he lands on 3 ideas. And one of the 3 ideas was to create a calorie-less food. So think about this. The guy that created Oculus, the guy that created Anduril, his in-between idea was calorie-less food. And so he spent a long time trying to figure out how to get food that could be nutritious to people, but didn't have the calories to help prevent weight loss. Because ultimately, after a year of research and study, he realized Americans on their own will not do the things they need to do to lose weight: diet,
He's,
sleep, exercise.
he's correct on that.
And it's kind of funny because here we are. That was around 2020 and 2021. That was around the time the GLP-1 craze was getting big, and now here we are. And people want to lose weight, they just go and get on Ozempic or Wegovy or something like that.
Mm-hmm.
So, and you can get them now for $150 a month subscription. Like,
Yeah.
it's crazy, but it's one of those things where it's like, where do you draw the line?
Uh,
Like you're taking one medicine so you won't be as hungry, and to influence some of these impulse controls and whatever else you have that was designed to be taken for patients with diabetes.
mm-hmm.
Yeah, so and it could be a poor example, but I think
No, I
about
think it's
things like
actually a very good example. But I
where
mean, we
where
could
do
look
you
at social media, television. I mean, how many things that could we point to over the years? Video games, cell phone, a car. I mean, you could say everything, anything could possibly cause us harm if we misuse it or abuse it.
Mhm,
The ice cream cone. I mean, relationships with people. All of it could be bad or good depending on what we do with it. It's a tool.
right?
Yeah,
That's
a,
a good
a
point.
shovel could dig a hole, or you could hit someone in the back of the head with it. What are we going to use it for?
Yeah.
And so, yeah, I think all of this technology we're talking about is the same way. And I like us having this ethical conversation about it because I think deep down, whether people admit it or not, everyone struggles with this concept of how to use this technology, how to use medicine, how to use everything we have in healthcare, and what's the best, most effective way to do it by ourselves, by society, and for the glory of God in cases like ours. And it's tough because it's not easy. It's not a thou shall not do this or this.
Yeah.
It's kinda left up to our own discernment of what's right and wrong based on our life and what our heart is behind the actions that we take.
Yeah. I think you're spot on there. I've got an investor that always tells me anything we do in business, service wise, or any decision we make. He always kind of reminds me, but he has this little rubric or this test for it. He calls it the Sunday school test. And he's like, anytime you have an idea, like for business, patient care, something like that, he's like, just think about standing up in front of your Sunday school class and explaining that idea to your class. And if you can explain it and everyone's like, yeah, that total sense. That makes total sense. You're probably on track.
That's
But
right.
if you get up there and explain it to them and they're, what? You're doing what? How are you making money again? And, he said that's kind of one way that he's thought about it over the years, just
I like it.
that faith base in. But yeah, think about or you could think about in the context of, your family, someone
Mhm.
that's not super familiar with your day to day, but has just enough of an idea that you can, hey, what if I did this? If you get the looks, it's maybe something you shouldn't do.
I think that applies to everyone. I mean, unless you are an actual sociopath, of which you don't care if I'm about to make this statement,
Right.
You could care about what other people think about your actions. Now, you might hide those actions, whatever they are. You might be embarrassed by them and not want to do them. But at the end of the day, if you can justify it to other people rightly, even if they disagree with you, but if you, in your heart of hearts, can justify what you're wanting to do and you believe that it is the right thing, odds are it's going to be a good thing. Not every time, but odds are
Yeah.
it will be
Yeah.
a good thing.
Yeah, the sociopaths don't really work in healthcare like they do other industries,
They
like
don't.
a Mark Zuckerberg or who's the guy that founded Uber, or even like
Yeah.
Adam Newman with WeWork. Some of those
Hmm.
guys. All the sociopaths in healthcare end up just being fraudsters that don't last long, like Elizabeth or
Elizabeth Holmes. Yeah.
there was another Indian couple that had a billion
Yeah.
dollar healthcare fraud from the TV advertising in clinics or something like
Right. Yeah.
those are those sociopaths don't. I will say healthcare is good about that because we're talking about patient lives, and so people do tend to take it more seriously, and the sociopaths weed out faster than other industries.
Well, they do, for those who are not familiar with what a sociopath is, I mean, we kind of think of these as very derogatory terms, so they actually are medical terms for someone who just doesn't, their body does not process empathy in the way that other people's are. So, like, I feel like I'm a very empathetic person. I can feel when someone's hurting, when someone's concerned, when someone's really happy, and some of it's emotional cues, and some of it's situational. But I can become very empathetic with someone. I feel life through them in a way, which is different than an empath, where an empath, if you go to like a Joe Rogan kind of thing, like that's like a telepathic kind of thing. Like you're
Yeah,
literally feeling
yeah,
their emotions. I don't buy into that necessarily, but I can be congruent with the emotions that someone has just based on I put myself in their shoes. Sociopaths don't have that. Whatever that tool is, they just lack that. So they
context.
go through life without that, and so their decision making may be slightly different, which is why the ethical conversations we're having right now probably are a little different between depending on the level of empathy someone can have. And like you said, Will, you got to have a pretty strong level of empathy to be in many nonprofit sectors and certainly in healthcare. I would also say education as
Oh, yeah,
well in most cases.
yeah. It's hard to work in healthcare and not care about people.
Yeah, I know
I
that
mean,
is.
even just day to day, the anecdotal stories, the struggles, the hardships, even the barriers that you face as on the administrative side in healthcare. It's hard not to see the brokenness within the system and how people, I mean, because in healthcare, it's one thing in other industries where it's just someone who, is just trying to be entertained or some other thing. But in healthcare, it's someone who's sick, who needs help, and their life's on the line. And so
That's right.
there does seem to be a bit more of a seriousness there. But I was thinking like on the topic of implants, there are probably tons of other examples that we could give for the contrast there. But if I had to kind of put my opinion on it, I would say that the intent is what will matter. And what I mean by that is, are we trying to make people better? Are we trying to improve quality of life? Are we trying to cure illness? If we're trying to solve those problems, then I think it's a noble cause, and we can try different solutions, whether they work or not. We can try. The the ethical implications come more into like that's more of the moral. The ethical comes more into the you know uh, if you're going to put an implant in somebody, there has to be a testing phase, and so like you're
Hmm.
going to get it wrong, and like that's where it comes, like Neuralink, that's where it comes more of a gray area for me. Is, even just to bring a product like that to market to test, like how do you do those things
Yeah,
ethically?
that's right.
How do you even bring the product to market? And then once it is to market, how is, I mean, because we're talking about, when we're talking about wearables, we're talking about putting batteries in people. We're talking about putting sophisticated electronics in people, which I know we do to a degree, but right now it's on an emergent acute basis. And I think what you and I are talking about is a much broader basis, similar to like the GLP-1s, where, CGMs or other things become more of an implanted thing. And now that I'm thinking about it out loud, one thing we haven't talked about is like, I wonder what the adoption would be for an implant market. Like if it's such a
Mhm.
question, what would the market's response be?
It's a really good question. I
I don't.
mean, I think you've
I can't
already
think
seen
of a
some
lot of
early
life.
adoption for people that have been really excited. Like what was the guy that originally embedded like a credit card chip into his hand so he could just
Yeah,
swipe it over the monitor when he goes to the grocery store, and other people have started doing similar things. Now those are early adopters. Those are people who are kind of on the fringes, I would say, of adopting technology because it's the cool factor, because no one else is doing it or whatever.
sounds more like a media stunt.
In a way, I think it probably was with some people. But there will be legitimate, people who lose limbs, and you have a robotic limb that's attached, and you get this now. Military, you're already getting that. We've had it for a while. I think the ones attaching to spinal cord, attaching to the brain, those are the ones I think from an ethical standpoint by far the most serious. And then
Yeah.
as you said too, those that are connected to the internet. And those are the ones, if there's anything that worries me, it's that. And it's not because of the ethical side, it's because of the cybersecurity side. Because if they're willing to hack a medical center right now and put it on a site, on a ransomware, what do you think they would do to an individual person? It's like
Mhm.
digital kidnapping at that point. And
Oh yeah.
that's
That
terrifying.
that to me, that's yes, that is the scariest thing. There's the, do you put something in your body? What is it? What is the efficacy of it? What are the safety measures around it? Will there even be adoption? And then the other side of it is, well, if you put that in, you're monitoring, and if you're monitoring, you're trying to get continual data collection. You're trying to get continual data collection. It's hosted on a cloud server somewhere. If it's hosted on a cloud server, it can be hacked. And to your point, the I think people think that hackers are out there, just trying to make some money. And for the most part, that's what the sophisticated groups are. But there's plenty of hackers out there that are just nefarious,
That's right.
like literally just want to ruin somebody's life because they're having a bad day or something.
That's right.
And that, yeah, and I think that's a big cause for concern. And it'll be interesting to see how it develops because outside of Neuralink and a couple of other ones more so related to glucose monitoring, you're not hearing a lot about implants
Hmm.
specifically,
That's right.
which it doesn't mean that they're not there. I mean, like anything else, as there becomes more of a market for it, you'll see people put products out into the marketplace. But, I think right now the skepticism that even you and I are having in this conversation is what the general public feels about that. I mean, I don't know anybody that read the Neuralink article and was like, "Yeah, sign me up."
I
You know,
know. There weren't many. I read the comments on a few of those, and there's always a few people, which is hard to even tell if it's a bot or if it's a real person on the. But I mean,
yeah,
there's going to be some people that they're into to things like that, and they want to just push their body or push science as far as possible, and they're going to be an early adopter for whatever reason.
oh yeah,
Like if you had an Oculus, but it was literally in your head, and so you can have information come up like a dashboard on your eyes. Which again, sci-fi sounds really cool. I'm not that great at learning people's names, so if I could automatically have their Facebook profile pop up on in front of me and I could scan them and know exactly who they are and why I know them and all their history, man, that would make dinner parties so much easier.
wouldn't it?
Yeah.
I'm
But
yeah,
again, do I want that in my head? And then do I want someone to be able to have access to my brain and hold me for
yeah,
ransom or shut it down and cause some permanent issue? Or just the device itself being fairly untested, causing an issue, overheating on top of my brain and
yeah,
burning a part of my brain. I mean, there's any number of things that could go wrong and may never go wrong. But I do think that's part of what we have to consider with the implantable devices is what are the odds of something bad happening? And that we have to do that literally. If you walk across the street, what is a risk reward ratio? My risk is I could get hit by a car, but my reward is I end up on the other side of the street where I need to go. And so literally everything in life should be a risk reward ratio. I just think that the risk of implanting something when it's not required is a
yeah.
higher risk than the reward will come out. If you're having something that's major neurologically or neuromuscularly degenerative, and this is something that could give you a high quality of life where you would have no life otherwise, the risk reward ratio looks a lot different for you. And I
Agreed.
think the
Yeah,
odds of doing that and wanting to do that are going to be significantly better.
yeah. No, I completely agree. I mean, that's the choice we all make every day by having this thing in our pocket all the
Yeah,
time.
it is.
Because we don't know long-term effects for batteries. We've only had an iPhone for what, 17 years?
That's right. Yep, batteries, the cellular technology. I mean, they say it's safer, but how many people have really run those tests to know? I mean, I don't know.
Uh,
We all have them. I've got mine right here, and it's with
Oh,
me
we
all the time.
we
So
do. They the thing that I was thinking about while you were talking just then that I hadn't really thought about before, it just kind of dawned on me. I don't know how much you keep up with like the longevity movement. Have you followed that at all?
a little bit, yeah.
I almost wonder, okay, and track with me here because I'm going to give like that grade school example. So, what GLP-1s have been to the weight loss market, I wonder if that's what implants could be to the longevity market.
Could be.
You've got the weight loss market, which for the longest time was based around, a team of either a doctor and a nurse and a nutritionist or a dietitian. And they would work with a patient on a plan that usually involved medicine, eating habits, sleep, other types of monitoring. And now you've got this miracle drug, so to speak, that can accomplish better results than that team could before for a fraction of the cost.
Hmm.
And you've got more of a movement. It's more with like the top, probably 10%, like the wealthier crowd right now. But a lot of those trends, as you'll notice, just like with GLP-1s, trickle down. Because what made GLP-1s hard to get for diabetic patients in 2020 and 2021? There was a massive movement because some real housewives started taking it. It got public, and then California had so much demand it caused a national shortage.
Yeah.
Or it may not have been California specifically. It could have been more of
Well,
an
but we can assume.
but yeah, so there's this national shortage, and I still remember, coming out of the pandemic and the beginning, hearing more about GLP-1s and the restricted access and how diabetic patients were having a hard time getting them because it was
Mhm.
being, used as this new designer drug. So I'm not trying to bash on GLP-1s. It's just an easy target right now because I can't scroll through social media without seeing the ads.
That's right.
It's like literally I had a screenshot album the other day, and just from like scrolling for a little bit, I was doing it intentionally looking for 'em. I found 6 different companies with a monthly subscription for GLP-1s geared towards just like it was like Hims and Hers and Row were the main ones, but then there's these other niche brands focused on dads or focused on businessmen or focused on
Hmm.
moms or like these other targeting schemes. So I was kind of thinking like what GLP-1s have done for that weight loss market, implants could do for the longevity. And so the longevity market, the one I think of the most is Brian something. He's the one that all the articles are talked about, but he's like in his late 40s, almost 50, and
Hmm.
he spends $1 million a year or something like that to try to make himself like to reverse aging.
Right.
So
Trying
he
to
like
actually
he's like
reverse aging. Yeah.
yeah, but he keeps up with everything. He's like, my internal organs are this age, my skin is this age, my brain is this age. Like, and he's constantly trying to like extend his life through essentially stopping the aging process as much as possible to extend his life. When we look at implants and a lot of the quality of life that we see in its reduction is around cognitive ability.
Hmm.
It's as cognitive ability starts to decline, there are kind of a cascading effect of other things that happen, like your equilibrium or your balance is off. And once you're at a certain age, if you're inactive and not super healthy and you fall, like that's pretty detrimental.
That's right.
So these different things that you could attack. That's where I see it. Like you could basically improve cognitive ability long term through the implants. I think.
That's right. Yeah,
I
and
think
I think it
just
would in that case. It would help. Yeah, the longevity movement, so, this is what coming again, back to the ethical side of it. People put this as the god of their life, like, "I cannot die, I need to live forever, I need to live to 120, 150, 180, or whatever." And, I mean, there's legitimacy to the science of what they're doing. They're taking in collagen in various ways, they're taking in various types of proteins and peptides, and they're trying to regulate their blood biochemistry, the super dosing on different vitamins and minerals and nutrients.
health,
And
healthy collagens, not not
yeah,
not Botox.
not Botox. No, Botox is very bad. Well, I say very bad. It's inert in some cases. You want to smooth out a few wrinkles, it's fine. If you're injecting it into your lips, maybe a little different.
Yeah.
But yes, there's the right way to do things and the wrong way to do things, and then there's the extreme way to do things. And some of the they're trying to take the science behind it, which I very much appreciate. Nothing wrong with it, the basic core of what they're doing, but like you said, $1 million to extend your life. I get it. If you've got the money, I mean, what else are you going to do with it? If you die, you die, and if you don't believe in,
There's a lot you could do with it.
yeah, there's a
Not
lot you could do with it. There's a lot of good you can do to try that doesn't involve trying to extend your life a few extra years. Now, if you don't believe in a savior who's died for your sins, you go into everlasting life. I get it. I would try to buy a few extra years of my life if I could. I just think that the irony is if I tried to do that, I'd probably get hit by a bus instead. So I have no desire to extend my life any further than the Lord desires for me to be here, but I do want to live as healthy as I can,
yeah.
and certainly the things we need to do from the wearables and the tools it can give us to track our telemetry and track our biochemistry and track our movement is great. And then if there is going to be an implantable that we want to use, just make sure we do it in the right way. At the end of the day, again, there's a limit to what I am willing to invest in myself that isn't just going beyond what I should be investing in others. And so that's for my personally where my line is. I'm going to do whatever's reasonable, but I also understand that I might just get hit by a meteorite one day and be taken out. So
That oh man, that was so good. It had me cracking up. I was just picturing like, you're going through all these like blood transfusions and collagen treatments and everything else, and you cross the street and just like,
yeah,
for what?
person texting on their phone.
Yeah. But kind of to put a bow on some of the wearables from our standpoint as healthcare leaders and people that work in healthcare, I think promoting wearables in general is fantastic because the wearables have gone from just like personal data collection to where we can actually get some actionable intelligence from some of
Mhm.
these devices. It used to just be like so that you could know, and now you can share, and things are becoming more open, and you know some of the larger tech companies willing to do BAAs and share data and things are super helpful. And so continuous care, predictive analytics, being able to look at those things for those patients is what is going to help us prevent those unnecessary ER visits, or from this chronic condition to exacerbating and getting worse, from A1C levels to continue to rise, or blood pressure to continue to get out of whack, or whatever it may be.
Mhm.
Staying plugged in, because one thing that we do see from the wearables is engagement. And when we talk about prevention, I think engagement is the thing that's lacking. You don't have a lot of, I mean, when we think about life, especially with short attention spans now, there are things constantly pulling on our attention. And so healthcare is not different, and it's kind of nice, and philosophically it's great to just be like, oh well, we just provide this, and people have to make their own decisions. But I think in healthcare we should do a better job of marketing towards engagement. Like all of the like we are competing with people's attention no different than Facebook, Instagram, TikTok, everything else. And so we need to be competitive in that and actually get their engagement. And wearables are a great tool to do that because it's something the patient has on, it's something they can do, they can touch, they can pull up an app, they can check, they can share, they can show other people. Like it creates a physical, thing to do. It creates an action within someone's life, and that is what helps set in some of the engagement. Like our patients that are 65 and older with blood pressure monitors are very active once they get a blood pressure monitor and taking their blood pressure. If
Mhm.
they didn't have a blood pressure machine before or monitor, then maybe they would take their blood pressure when they stopped in at the pharmacy. But as soon as that tool's in their hand, the behavior starts to change. And it's not just the tool itself, it's a team of people behind that tool that are encouraging it, coaching people on its use, on its benefits. And so it's the mindset change on that fulcrum that you talked about, going from sick care to prevention. And I think the wearables are one of our best underused tools in prevention.
Yeah, I agree. I agree. Well, we'll wrap it up there. That's a good way to tie a bow on it. We appreciate your time today. Appreciate everyone for joining us on the podcast today, Healthcare That Clicks. We hope you enjoyed our little analysis of wearables and plantables, and then the ethics around it. Which I will admit, we probably dove into the ethics a little more than I thought we would, but I'm glad we did. I think it's an important consideration we all need to have when we're discussing the use of technology in our healthcare and what is the appropriate way to do it. So I think it's a great market. I think the technology is phenomenal and it's just advancing faster and faster. Every year there's something new coming out, but like everything, it can be abused. So using it the right way is going to be good. Using it throughout our healthcare system, if we get the data and we're able to be actionable on that data, it's even better. So we'll appreciate the good conversation today.
Yeah, pleasure as always.
Thanks, everyone.